everyone. So in this video I am going to show you trunk flexion MMT. So first we will start with grade 3. Whenever we have to do MMT, first we check grade 3, and if grade 3 is fine, then we will check grade 4 and grade 5. If patient does not have grade 3, then we will check grade 2, grade 1 and 0. So let's start this video. So the muscles that are involved in trunk flexion are rectus abdominis, oblique, externus, obliquus, internus, and accessory muscles like psoas major and minor. Now first we will start with grade 3. Now there are some important points which you should keep in mind while taking MMT. So first, the chin of the patient. The chin of the patient should be facing towards the ceiling. You should remember this point. It should be facing towards the ceiling. You should not do cervical flexion. So patient should not do cervical flexion and chin should be facing towards the ceiling. The hands would be outstretched above the plane of body, and then patient has to flex his trunk. Patient has to flex the trunk until the inferior angle of the scapula is off the table. So this thing you have to remember. If patient has grade 3, then we will check grade 4. So for grade 4, patient will cross his arms over the chest and then he will flex his trunk until the inferior angle of the scapula is off the table. In grade 4, this crossed arm position will act as a resistance and chin will remain pointed towards the ceiling. Now if patient has grade 4, then we will check grade 5. For grade 5, patient will be in supine line and hands will be touching the occiput. They should be slightly touching the occiput and you should not clasp the fingers like this. So hands should not be clasped, because if we will clasp the hands, then we will lift the head with supports of our hand and we don't want that. So you should not clasp the hand and you just have to support the occiput with your hands. Then the patient will flex the trunk until the inferior angle of the scapula is off the table and chin should be facing towards the ceiling. If in case patient has lack of stability of pelvis or weak hip flexors, or he is doing active hip flexion, then therapist can stabilize the pelvis with the forearms. In case if patient does not have grade 3, then we will check grade 2. For this, the patient will be in crook line and hands will be supported on the couch. In grade 2, patient can only lift his head from the table. So this is grade 2, but in case patient cannot lift his head, then there is a sequence to check grade 2, 1 and 0. For that, the therapist will support the upper trunk of the patient. Therapist will put his hand over the linea elbow of the patient to feel the muscle contraction, and we have to tell the patient to cuff. When patient cuff and you feel there is depression of rib cage, then that would be considered as grade 2. But if patient cannot cuff and you will feel the rectus abdominis muscle activity, then that is grade 1. And if you are not feeling any contraction, then there is grade 0.